Before we started in emergency medicine residency at the University of South Alabama, the saying I heard over and over is that it's an ideal training center for emergency medicine. Our university hospital is a combination of a tertiary referral academic hospital with a county hospital sort of feel to it. You get all of that experience right there at one place with strengths in academics, focused pediatric experience that's interspersed throughout the residency program on every ED rotation, all in one place.
In the first year as an intern, you work 2 months in the pediatric ED. And then as a second and third year, you're expected to do 25% of your shifts in the pediatric ED when you're on an EM block. Having kids, I'm pretty familiar with all the sick things that kids get. But as someone who doesn't have kids, I think that'd be an advantage to come in here.
There are a lot of different things that I feel like make our program unique here. I think one of them is where we're located geographically. So being on the Gulf Coast, there's not a lot of academic centers close to us. And so we pull from a huge catchment area for a lot of different medical complaints, which I think makes it a great environment to train in. So we see strokes and trauma patients and burns and pediatric traumas from a huge catchment area. And so we have a really high volume of critically ill patients. I think that's something that's really unique to our program and also an advantage to where we're located in this part of the country. There's not a lot of other facilities we're competing with.
Essentially, all of the rotations are done within our health system. You don't have to go to another trauma center or someplace to get that experience. It's all within our faculty at our institution, teaching you at both hospitals.
We train everywhere. We're the one service in the hospital that sees everybody. Everybody actually knows my name. We go from trauma surgery to be exact, to OB-GYN, so we're delivering babies, and then next day we can be in the pediatric ER, and which is great because everybody knows that an ER resident can do anything, and they really take that as an advantage in the hospital. So I know a lot of the attending, and I know a lot of the residents from other different services, which make it much easier to make consults. And having that relationship makes our job much easier and enjoyable.
We have a lot of people who are older, seasoned, experienced people. We're also bringing in a bunch of new faculty who are fresher, just got out of residency. Some of them I haven't even worked with yet, so I'm excited to work with them and learn from them.
Our faculty come from programs all over the country, so we bring a lot of different perspectives to our program and our faculty, which I think really strengthens us.
We're not a huge hospital, we're not a small hospital. We kind of have this nice sweet spot in the middle. And so we have, I know all of the residents really well. I know all of the other faculty really well. We're not some big, huge program where you've only heard the chair's name once and seen them in passing.
We know them on a first and last name basis. We've met their families and they've met mine. So it's just great to have that personal relationship with my attendings because they know me as a person because we're so small of a program. And it's definitely a family more than just a residency program.
And I would say that the camaraderie between residencies is the best I've ever seen here. The residents in various specialties getting along together, cooperating, collaborating, that's something you don't see at all other academic places. It's just much more collegial here in a very good way.
Our program is new, and that just allows us to have a lot of ownership of it. I'm on the PEC committee, which is kind of the committee that does a lot of the educational rules and regulations, and whenever we're at those meetings, it's very active. I don't just sit there. I talk a lot, I give a lot of input, and a lot of the things that I've advocated for actually do get implemented eventually. I just don't think you get that with other programs.
Everything's nice and large, it's easy to run traumas, everything's at your right next to you. We have all of the supplies that we need. We have enough room for x-ray to come in, and we can even just take them right to the CT scanner. No fooling around with taking them down the hallway. Literally, we just open the back door from the trauma base and we're right to the CT scanner, which is much better for the patient and much better for the providers too.
I really like that with our emergency medicine schedule, sometimes I'm off for a few weekdays in a row, and I have the opportunity to go down to the beach and hang out at the beach and just kind of get a break from work and the hospital life, and it's an hour and 15 minutes away. It's been really exciting to try out a bunch of new restaurants. They have excellent cocktail places, and so I think just getting to explore the food scene, I was really impressed with what Mobile had to offer.
I give the same advice to absolutely every applicant. It's at the end of the day, it's wherever you're going to feel best. You know, you really sit down and you think to yourself, what did I see, what did I smell, what did I hear when I was at that program? And you really just kind of sit and resonate with yourself, like, where do I really see myself there? Now, the nice thing about this program is that it's pretty easy to see yourself here. Again, everyone's very friendly, everyone works really well together, and that there's a lot of movement that you can jump in and really kind of take reins of something. If there's something you feel passionate about, you could probably get it done here.